All right, today we're going to talk about long-term care. And so this is in contrast to what we were talking about in terms of acute care, which was a short hospital stay. And so that's where we take care of you immediately post-surgery, if you have pneumonia, appendicitis, things like that. So this is once that you, these are for people that need something beyond what you would have in what we think of as a typical hospital stay. First thing I want to mention, any of you that are attracted to this particular field, and there is a great demand for hospital administrators, nursing home administrators in this field. So if this is appealing to you at all, this is a good career choice. But unlike hospital administrators, nursing home administrators must be licensed. And so I put a link in here of some things of what you can learn about, of what it takes to become licensed. And for those of you in healthcare management, if you are, when you go to plan your internship, you may consider doing that in a long-term care facility, and potentially in some cases that can count for part of this administrator in training. So what is this? It's a place that is residential that provides temporarily or chronically care to disabled persons. Okay, so it's over an extended period of time. And so the goal is to get the disabled to function as independently as possible. So some of this you may be there forever, some is temporary. There's a list of characteristics of long-term care. So as we say, maybe temporary or permanent. It can be for cognitive or functional, particularly with the increase in number of people with dementia, such as Alzheimer's disease. It's not old-timers, it's not Alzheimer's, it's Alzheimer's. That is a man's name who named it. All right, so with this, there are cognitive disabilities as well. And so there is a large increase in the number of people requiring care for mental dementia issues. And so that kind of creates an additional demand, that additional supervision, and is another reason why there's going to be so much growth in this field. So what we're trying to do is to get you to be able to function as independently as possible. And with that, we address mind, body, and spirit. The care is designed specifically to the needs of the individual. So we're going to look at some of the ways that we deliver this care. Here's a whole list of who we consider to be long-term care providers. So we tend to think of nursing homes, and yes, that is a category. But there are other places where we do this too. Some hospitals have long-term care units. There's also what we call assisted living facilities. And we're going to talk about these kinds of facilities in a minute, but think of it this way. There are these large complexes that we'll look at in a minute, and people come in and independently initially. So my mom was in one of these. And so basically she had an apartment. It had a small kitchen in it, but she got breakfast and dinner in a main dining room. And so with this particular one, it basically was an apartment, and then with a huge dining room and lots of activities. So there really wasn't any kind of what we call nursing care involved in that. However, as you age and your needs expand, then they can add services such as a nurse coming and administering your medicine. somebody coming and helping you bathe. Maybe somebody comes and helps you get dressed in the morning. Maybe somebody needs to come and you're in a wheelchair and push you down to the dining room. Adding these kinds of services to independent living is what we call assisted living. And so there's a lot of different forms of assistance. Now, in addition to this, there are other things that are different than the categories above, including home health. When they can, it is sometimes good to get this care in the home. So, for example, Meemaw has a hip replacement. She's got to have physical therapy. She lives alone. All of her kids live out of town. They all work, etc. And so home health, they may say, yeah, you need rehabilitation to get you back up to strength with that hip. So we're going to send a physical therapist, an occupational therapist, some personal care people to your home and do it in your home. Then you won't have the transportation issue. But think that through. It's a lot more inefficient for a physical therapist to visit 8 people in their homes as opposed to being in a facility and the patients go to them and they see 10 people in a day. All right. So, but home health has a lot of benefits as well. We've talked about hospice. Basically, hospice is, it can be inpatient and it can be outpatient. And it's for people who have been rendered a diagnosis that is terminal within a 6-month period of time. Basically, what it says is you are ready to not get more care, more acute care. And so let's say you are a cancer patient and they're like, yeah, this is terminal for you. You may still get some treatment because some of that treatment is palliative. It helps you with the pain. So they're not treating you because they think that it's going to cure your cancer, but they're treating you to help minimize some of the effects of the cancer. All right, so that, as I said, it can be inpatient or outpatient. Also, there's adult daycare, and so just like child daycare, but just stick an adult in there. So it's a central place where particularly working people can take an adult member where they're supervised their activities, perhaps they're fed lunch. And so it allows the family to continue with their life, but have supervision and activities for their loved one. Then there are a whole bunch of community-based things that we do. Meals and Wheels is a simple one that we all know where someone has trouble getting out and getting groceries or food or can't really cook for themselves. And so we're going to bring that nutritious meal to you. So as I said, there is a continuing care retirement community. And these big facilities, large campuses, they're in most towns in the United States, but they have these different levels of care all on one campus. And so sometimes people start with this independent living. In my mother's case, this was like a big high rise with some grounds around it and a pool and that kind of thing. So it could be independent living. Once, if you have needs, you can go in and out of this assisted living where there are people there to help you with that. And then the third level or highest level is you need nursing care, and under that kind of level of supervision and housing. So 3 levels there. Many are church affiliated. There's different ways that you can pay for this. Some is monthly. Some require this upfront fee to allow you to be at this facility. But this is a growing phenomena, and many of you may work in these. So how would we decide which level you can function in? Go back to these activities of daily living and the instrumental activities of daily living. And so they come in and assess you, and they're going to see, can you do these kinds of things? And based on that assessment, they would determine which level of care is appropriate for you. Now, this is a very intuitive slide that as you age, you are going to be less, most people are less functional. And so just some idea of the progression with problems with activities of daily living. So these long-term care facilities provide several different things: medical care, nursing care, rehabilitative care, personal care, and residential care. And so some of them have very, very active people. My mom had like a craft room. My favorite one where I would be is there was a hot poker game going every night. They had wine tasting. They had music come in. They decorated for every holiday. They had a pool. They had card game, puzzle rooms, card rooms, a woodworking shop. So there was a lot of activities, and actually one of our graduates, that's what she does in one of the big facilities, is she organizes all these different activities. Some idea of the size of the nursing home industry in the United States and North Carolina, though it does continue to grow. Now here's something that I really want you to focus on because it's important that you understand this. Remember we talked about hospitals, and the largest single category of a hospital was that private, not-for-profit hospital. All right, came out of churches organizing to take care of indigent and the pest houses and whatever. Nursing home industry is very different. This is more of a for-profit business. And so you can see here, North Carolina, even more as compared to the United States, that many of these nursing homes, now we're talking about strictly nursing homes at this point, are for-profit businesses. And not only are they for-profit businesses, they're also what we consider chains. And so a chain is an example of that horizontal integration we were talking about. So McDonald's would be a chain. So these companies these companies own multiple facilities, sometimes in a region, an area, sometimes nationwide. So for example, what college are we in? The Beaver College. All right. So we are in the Beaver College of Health Sciences. That's how Don Beaver made his money, in nursing homes. Okay. And so he had multiple nursing homes, and he wanted to give back to the community, and that's gave a big chunk of money, and that's why our college is named the Beaver College. All right. So big difference here than hospitals. These are basically for-profit businesses, and they usually have multiple facilities. So if this is this is an occupation that you're thinking of, then not only could you go in and work in an individual facility, being an assistant manager, moving up to manager, but you also can move up to corporate. Okay, so there's job growth in this. And many of our graduates are in this field. And they're also very active in our advisory board. They love our graduates. They say the demand is high and the salaries are increasing. So let's take a look at, now we're talking about nursing homes specifically. And so who's in these facilities? So once again, intuitively, if you look at how old they are, the older you get, the more you need them. So You can see in the pie chart on the left that as people age, their proportion increases. Also, this is somewhat of a female phenomena. And so why would that be? Well, this is observational on my part. Can't tell you the specific research, but what I've seen happen a lot of times in our society, we protect women in a certain way, and we're somewhat uncomfortable with an elderly female living on their own. All right, so we want them into a place where they can take care of. Now, we know the other thing is women live longer, so that's going to be part of it too. But there's a third phenomena that I've seen happen a lot of when a man loses his wife, there are a lot of available females to him. And so it is not unusual for men to remarry. Not always. This is not a blanket statement. But it is something that happens a little bit more frequently than females remarrying. So the other thing is, it's not unusual for a man to take a wife that is 5 or 10 years younger. All right. So and we're also just not as uncomfortable with a man living alone as we are a female. All right. So some of this is just traditional gender things, proportions of the population, how capable they are to live on their own, etc. The last pie chart here is looking at where were they before they had to go into a nursing home. So you'll see the biggest chunk is they were in the hospital, and this is not an unusual phenomena. Mima's fine, she's living alone, she's functioning well, and something happens. It is not unusual for that to be Mima breaks her hip. It could be other things, but that's a very common one. And so she's in the hospital getting her care, and the family is not able to take care of Mima at home, and they feel like she needs to be under that kind of supervision. Sometimes they're in assisted living. So my mother, for example, she was in independent living. That went well for many, many years. Then she started having health issues. She needed assisted living. She was in that for about 6 months. And then she had another health crisis and needed nursing care. And so now she was 91 years old too. So this is not a young person that this is happening with. But so that's an example of kind of the progression that we see. Some go directly into nursing care from a private residence, that they're living alone and they go directly into a nursing home. Okay, so that's kind of some demographics there. Now here's the thing, how long do they stay there? Average of 2.5 to 3 years, okay, because of either cognitive or physical disabilities. So we're going to see what's an issue with that. I don't want to call it a problem, but one of the issues that we're going to talk about in just a second is just how costly these places are. So think of this number of 2.5 to 3 years when we start talking about how expensive these places are. So here's some things that they generally get help doing. Another issue is half of the people in these nursing facilities have some form of dementia. Also, half have depression. And this is a challenge for us right now with the COVID crisis, because as we know, and you can well imagine, this population This is what was happening out in Washington, state of Washington, that kind of started this huge death toll from COVID. But there are other places, like in Louisiana, they're having issues with in nursing facilities with COVID as well. So half the people already have depression. If you've been in there, if you've gone to visit someone in a nursing home, you would get it. So what's heartening is we see these beautiful things happening. Families can't go in to visit their loved ones because their loved ones are at such risk right now. So you see these really cool things. A lot of these places have some kind of window outside the room the person's staying in, and the family will go and bring a chair and sit on the other side of the window, and they'll talk to each other on the phone, or they're throwing a birthday party for them or something like that. So there's just been a real request of all of us to volunteer to send some cards, make some art, do something to send to help these people that are now more isolated than ever. All right, so as we said, this is the preponderance of people in nursing homes are women. So here's the money issue in relation to this. Nursing home care. If you're in independent living, you're paying for that yourself. If you're in assisted living, if you have long-term care insurance, it may pay for some parts of that, but you're paying for that yourself. If you have to progress to full nursing home care, nursing facility care, that is, you would think that would be covered by Medicare, but it's not. There's a small portion of it is. So let's look at what that portion is. Meemaw breaks her hip, and she goes into 28 days in a rehab facility or a skilled nursing facility after she gets out of the hospital. So she's in the hospital for, I don't know, 5 days, maybe a week, but probably 5 days. They want her out of there. That's an acute care place. She's not staying there. So she needs some intensive rehabilitation. Medicare will pay for that part. Okay, so it'll pay for all of 28 days, a chunk of the next 30, and a really small chunk of the next 30. So up to 90 days, some proportion. That's what Medicare pays for. So the rest of this, you either have to pay for yourself, your family has to pay for it, if you have the resources. But if you don't, and so let's say that you've got a little bit of savings, then after you spend down that savings, you now qualify for Medicaid. You are now poor. After you spend down all your assets, you are now poor, and Medicaid will pay for nursing home care. So remember, we saw that when we looked at Medicaid in particular. So it's a very important to understand because, you know, a lot of, I will say, Congress people, when they were trying to decrease the amount of Medicaid, let alone not increase it under the Affordable Care Act. And so they're thinking, you know, it's these poor people that aren't willing to work that are on Medicaid. They did not realize that one of their key constituencies, the elder population, were on Medicaid. All right, so it's important that you understand that. So as we said, Medicare does pay for some of skilled services after a hospital stay. All right. And then to be eligible for Medicaid, a resident can have no more than $2,000 in assets. Any of you have a car? Okay, you've got $2,000 in assets. All right, so it's not easy to get on Medicaid. So you really have to spend all of your money to qualify for that. So one of the things that I'm not going to ask you these specific rates, but what I want you to understand is just how expensive nursing home care is. A good nursing home costs, like a really nice one, $100,000 a year. Okay, a pretty good one, like the one my mom was in, I think it was $5,000 a month, so that would be $60,000 a year. A really not nice one at all, crummy one, $4,000 a month, $3,600 a month. All right. So you see what the issue is here, and the kind of money that you would need at the end of your life if you required this kind of nursing facility care. You can buy long-term care insurance. There's a lot of different kinds of that, and so it's expensive, and you can't wait till you're older. If you wait till you're older, they're not going to give it to you. So my sister, who's 70, she just tried to get it again, and they said, no, you're not. You got too many conditions. We're not giving it to you. I don't know if I could qualify for it or not. So if it's something that you are someone who likes insurance and want to insure, it's really something that you should get probably before you're 60 is what I would say. So I don't know, maybe your parents are looking at this or something. All right, so that's the issue with this. This is what it is, but it's extremely expensive. People run out of money. Now, the other thing they do with this Medicaid stuff that you need to understand, they have what's called a look back, because what people were doing is Meemaw was giving all of her money to her kids, and so now Meemaw was poor and trying to apply for Medicaid. They started a 3-year look back. Okay, so they go back 3 years in your financial statements, and they're like, okay, where'd that money go? All right, so they're not just going to easily give you Medicaid, and it is not easy to game this. But I think you can see from, this is the end of this particular unit, so we've looked at outpatient services, what that phenomena is. We've looked at hospitals, how hospitals are now organizing into these big integrated delivery systems. And then this ends this last section of this on the long-term care.